Hello, my name is Sophia and welcome to yet another episode on palliative care. Today we are down at Lira Regional Referral Hospital and we are going to take you into the unit on palliative care. But let's get to hear from the experts themselves as they explore and tell us more detail on the subject matter. Join me for this special edition. Palliative care was introduced to Uganda in 1993 by Dr. Anne Merriman. The high prevalence of HIV, AIDS and cancer drove the development of palliative care in Uganda. The majority, that is 85% of palliative care services in Uganda, are provided by public health hospitals, and there are also 77 private hospices or palliative care services in private hospitals in the country. Palliative care units provide specialist inpatient care. A palliative care unit is a department specialized in the treatment and care of palliative care patients. It is usually a ward within or adjacent to a hospital, but it can also exist as a standalone service. In Lira Regional Referral Hospital, the palliative care unit is within the hospital. The aim of the palliative care unit is to alleviate disease and therapy-related discomfort and, if possible, to stabilize the functional status of the patient and offer patient and carers psychological and social support in a way that allows for discharge or transfer to another care setting.
My name's Eyoga Nyakuru Yakobo Betty. That is my full name. I'm a senior nursing officer, whom these days they call senior assistant nursing officer. My role in the hospital is to help patients to alleviate them from pain. And I work in palliative care unit. I am the in charge of palliative care unit. In the hospital, we normally have rotations. They can take you to work anywhere, so long as you are an employee in the hospital. It is not you to choose. So it is the office, the head of nursing, who deployed me in palliative care. I've been working in other units, but I think they feel I should also come and give the service in palliative care unit. It is not a choice, but it is a deployment by your head. Palliative care unit, it is a unit which really, from the beginning, it is a bit stressing because of the conditions you see. But with the time, as you are handling these patients, you will really feel that these patients, they need your help. And indeed, when if somebody comes to you with the pain and you have relieved the pain, it is your joy. And palliative care unit, we really need to be having what we should have in hand to help these patients, like the drugs, the sundries. Others, they need those sundries. So those are the things we need. And in palliative care, it has given me now, I could say it has given me hope that even though somebody is in very severe pain or somebody is in a very serious condition, you can make this person happy by removing that pain, even though not the treatment, but even you are talking to them, you are counseling them, makes them happy, and somehow they can also forget of the pain a bit. So it is a very interesting unit. And The beginning, when you see those conditions, you will begin imagining a lot. How will I manage this? But as time goes, you get yourself managing very well. And they do appreciate. They appreciate the hospital. They appreciate the nurses working on them. They do appreciate. As they come, we normally give them different dates. In one day like this, when we congest them, they can reach like roughly 15 to 20. And when we split them on the different days, we can see like average, all the patients, we can see like 10 of them. And in new patients, at least 3 to 5 we don't miss. You know, palliative care, it is for those chronic conditions. They all end up with us. So, cancer patients, cancer of different types, we see them. We see sicklers, ranging from actually all ages. We see them. And there are some people who even got some accidents. They are broken their spinals. They are all the time in pain. We see them. Any chronic condition, they normally refer them to us. But cancer patients and sicklers are the leading. Cancer of different types. The success story, I could say, a patient who came, who had no hope of her pain. But as time went on, as we continued handling her, she got, not really, palliative care is not a place for treatment, but it is a place for relieving pain. And making, if somebody is to die, the person should die without pain and very happy. So, my success story here, there is a patient who had lost total hope. I cannot disclose the name. And the patient, as we continued handling, it is not me alone, we were 3 in the unit. 1 has gone to school, but we are 2 remaining here. We just keep on handling them like that, and we continue counseling, health educating them. And the patient up to today is living and is very happy. He's already has accepted her condition, and she's living positively with it. And at times she comes to thank us. She comes, she even goes to the office to thank the office, because of the frequent supply of, though we get problems with the supply of morphine, it is not only here in Lira, it is everywhere. Shortages are always there. But she's very happy, and it is my success story.
The facilities primarily treat cancer, HIV/AIDS patients, and patients with other conditions such as hypertension, arthritis, and congestive cardiac failure. This indicates an important epidemiological transition and the need for palliative care services to partner with organizations focused on treatment of non-communicable diseases to increase access to those in need and ensure sustainability of palliative care services.
I'm called Ongom Beatrice Sawor. Initially I'm a nursing officer, but now they call me assistant nursing officer. My role in Lira Regional Referral Hospital to treat patients and to make sure they're healed if necessary, and to counsel patients. It is good, but it's stressing because we receive patients who are, some of them are chronically ill, some of them have severe pain, some are really, especially sickle cell patient in crisis, so I make sure I treat their pain, I counsel them, and those who are chronically ill, I make sure I prepare them for life after death. First of all, it is a new unit in the hospital, but the hospital has given us a small room to use to give the service to these patients who are in pain. The challenge is that we have patients who are chronically ill, and we need to go out to the community to care for them. That is home-based care. But the challenge is that transport to go there, sometimes the drug is out of stock. And you know, when the drug is out of stock, there is a problem. We just go and give counseling to them just to make them settle, comfortable, and have hope for themselves. Sometimes we give them to buy codeine to be using at home, because sometimes codeine is not provided by national medical stores. So when morphine is out of stock, we give the codeine so that they buy from the pharmacies and they keep using at home. And the challenge is that some of them financially they are poor. We have always succeeded with some patients on chronic conditions who have no hope. But when we treat them, we prefer them to other doctors. They get other treatment, especially Mulago. They come back, we continue counseling and treating them. Some of them get better. Then another one, we have some patients with sickle cell, which are in crisis. We treat them, they get better. And I have one whom I have succeeded. He's now recruited in the hospital as a driver and is doing well. Initially didn't know that because we can treat pain. So when we started treating the pain, he was at the same time getting treatment from the pediatric doctor. At the same time, when he's in crisis, he comes here for treatment for pain and he gets better. So all the time he's having drug with him. So whenever he starts feeling a pain or there is any sign of pain, he starts the treatment early enough. And these days doesn't have any problem.
The person watching me right now, my advice, I'm advising them. My advice for them, they should know that a patient who has a chronic condition, they should not leave that patient to die at home. They should bring the patient to the hospital. We have service here of palliative care. And I'm encouraging them to come to the hospital. Lira Regional Faro Hospital is the center of palliative care. And we receive patients in all corners. Whoever is hearing me now, whoever is seeing me, I don't know, is seeing me now, I'm advising them, any patient, anybody who is having any chronic condition, who is having pain all the time, let them bring the patient for palliative care service in the Lira Regional Faro Hospital. We are always ready to receive them, and we welcome them, and we shall journey with them until the end. We don't know the end, but it is God who knows. And I'm very happy to you people that you have come to see where we are Indeed, you have seen that we are really giving service of palliative care to patients. So when you go back, also encourage those people from there, tell them, Lira has palliative care service and it is free, it is for everybody, regardless of religion, tribe, race, let them come. We are here for them.
I'm very, very happy for the people of Uganda Broadcasting Corporation to come and hear from me about palliative care. It will help also them to broadcast so that people get to know about palliative care, and they will come, those ones who have not been aware, they will come back and continue with us. And I'm also happy that this information will reach the community, the whole nation of Uganda about palliative care. Because right now I am serving 9 districts in northern region. 9 districts. But some other people are not yet aware of the condition or where they should get the treatment.
The Palliative Care Association of Uganda, in partnership with the Ministry of Health and other partners, have seen the spread of palliative care services to about 94 districts of Uganda. Almost all referral hospitals have established palliative care units, and 13 standalone hospice organizations offer palliative care across the country. Currently, the growing number of older and increasing prevalence of chronic illnesses means that more people may benefit from palliative care in the future.
I guess we have told you the whole story. I guess you have seen it all. And this was our last special edition on palliative care. And it's a service I believe that we all need to get educated about, get acquainted about. You do not have to be a medical personnel to know about it, because you never know when you'll need this service in your home, or when your neighbor will need the service. But we'd like to thank so much the government of Uganda for enabling this service to be located in most of the regional referral hospitals and access. And not forgetting, it is for free. It is for free when you find palliative care in regional referral hospitals. Thank you so much. And that is all we had for you. Bye-bye.